Hi, I'm Jamie Marbo with Inspired Hygiene. I recently just got back from speaking in Iowa at an annual district meeting. The room was filled with doctors, office managers, hygienists, and assistants. We did an activity where we divided the room into 4 equal parts, and I had each of them write down what their ideal day would look like. And then after that, I wanted to know and have them write down what roadblocks or obstacles kept them from having that ideal day. Almost all 4 groups wrote down have an effective doctor exams. And here's what their concerns were. How do we have an effective doctor exam where the doctor is able to communicate the needs effectively to the patient, answer the questions, and also get to the chair in a timely fashion and leave in a timely fashion? So here are the 3 things that I know work to help you have that effective hygiene or doctor exam and not have it become a roadblock. The first thing you try to do is you always request the doctor to come do the exam after you've gathered all of your data. So after you've done your health history, you've gathered all of your images, intraoral and extraoral images, as well as a head and neck exam, full mouth probe, and addressed the patient's issues or concerns, you can then know what type of services that the patient is going to need, especially from a hygiene standpoint and or from a patient concern standpoint that you have discussed. You can let the doctor come over and interrupt at any time because you will know and have your information that you can hand off to the doctor, or what we call teeing up to the doctor. I like to tee up everything. That includes even the chit-chat, the warm fuzzy type conversations, so that I can streamline the doctor and direct the conversation as to something that the patient and I have already discussed. I'm going to role play this out from start to finish to show you how this goes. And the last thing is, how do we have an effective doctor closure so that the patient feels like all their questions have been answered, but also so that the doctor doesn't spend any unnecessary time doing some educating or explaining that the hygienist and or the front office admin people can be discussing, and the doctor can get out of the operatory in a timely fashion. So once I have gathered all the information that I need, all my data, and updated everything that can make me move forward with having the doctor be alerted to come do the exam, I will now have the doctor come to the chair, and Dr. Jones will come to the chair and say hello to myself and also Mrs. Smith. And so once the doctor says hello, I start right away and I say, Dr. Jones, Mrs. Smith and I have updated all of her necessary documents, and also we were discussing that she and her husband just got back from Hawaii, where they were able to go swimming with the dolphins, and they had a wonderful time. This leads and tees up the personal conversation part, and hopefully that keeps it from being opening up to, hi, how are you doing, Mrs. Smith, and what's new? We don't want that open statement that he or she can bring up almost anything. So I direct some of the personal things that the patient and I have talked about. The next thing I say is that we updated the health history, and Mrs. Smith has indicated that she is insulin resistant right now, and she has taken some oral medication to hopefully keep herself from getting diabetes. She does have a family history of diabetes. I also updated her blood pressure, and it is within normal range, and we're all happy about that. I talked to Mrs. Jones about how important it was that she, and how much we appreciate her answering and updating the health history, and how using that information is useful in how we move forward with her recommended treatment, especially now that we know about periodontal disease and diabetes being a two-way street. Also, Dr. Jones, Mrs. Smith and I were also discussing how her periodontal readings, her measurements are not within that normal range, and her bleeding, what we've been trying to keep under control, is just not working. It's time to do something different. We discussed how there's a chance that we will maybe need to do some periodontal therapy. I haven't gone into all of the answers to what that is with her, but as soon as you're done with the complete exam, and if you agree with the findings that she's exhibiting, we will move forward with answering those questions, and I will talk in more detail with her. She also is indicated she has some sensitivity on the upper left. We talked about how she has recession up there, and that may be due to the recession, and we might try some fluoride varnish and or some toothpaste, desensitizing toothpaste that she can use at home. So I have teed everything up for the doctor. The doctor can now say, oh, looking at these measurements, I can see why Jamie has been discussing and is concerned, especially knowing that you have a family history of diabetes and you're trying to keep your insulin resistance under control. I will sit you back and take a look, and then we'll go over what it is that we may be recommending to you in detail. I have the images up. I have the probe sheet that the doctor can see that the patient and I have been looking at, and the doctor now does the exam. If indeed the doctor is going to recommend some different treatment, we always have the patient sitting up eye to eye, knee to knee. The doctor will go briefly over what has been needed, what is needed, and what he or she recommends. The last thing that the doctor says before he or she leaves the chair is, Mrs. Smith, do you have any other questions for me, or questions that Jamie can maybe answer, or Sue up front? If you don't have any questions for me, then I'm going to go ahead and leave you in the capable hands of Jamie and the rest of my team. If you think of any other questions when you get home, please do not hesitate to give us a call. Any of the staff members will be able to answer those questions for you. Thank you, Mrs. Smith, and have a great day, and I'll see you when you come back. So that is how the closure goes. Hopefully by following these 3 simple steps, that will streamline getting the doctor over to the chair. It will make the exam go efficiently and effectively, and we will also address how the doctor leaves so that the patient knows that any further questions do not need to be addressed to the doctor, that they can be addressed by somebody else in the staff. So if you or your team find that there's any other areas that you would like help with that Inspired Hygiene can help you with, please feel free to give us a call and reach out to us. Thank you very much, and make it a great day.